Hi, this is Kenny Perez, and today I want to talk to you about anxiety and the medications that you can take to help you with anxiety. So, let me start off by describing the different types of anxiety. For example, you have the panic disorder, these are patients that experience repeated panic attacks. You have the agoraphobia. Patients with this condition fear situations or places such as entering a store. There's also the specific phobia, specific objects or situations. So you can have phobia, I don't know, a place that scares you. Also, there is the social anxiety disorder. These patients imagine themselves embarrassed when they speak or write or eat in public. There's also the separation anxiety disorder. Patients become anxious when separated from a parent or other attachment. There is this generalized anxiety disorder that a lot of people have. Although they experience those episodes of acute panic, these patients feel tense or anxious much of the time and worry about many different issues. And symptoms can really vary depending on the diagnosis. They can range from chest pain, chills. Some have symptoms that include shortness of breath, rapid or irregular heartbeat, nausea, dizziness, and tremors. One group of medication that I believe is good for these types of symptoms are the benzodiazepines because they are the leading treatment of anxiety and are less dependence inducing and have less abuse potential. These side effects of benzodiazepines include sedation, lethargy, ataxia, motor, and cognitive impairments, slurred speech, and amnesia. And they may include respiratory suppressions, depression, and in some cases, a paradoxical excitation and agitation. Anxiety disorders are believed to be the most common mental health problem in the United States. Baxter and et al. 2013 conducted a meta-analysis of 87 studies from 44 countries between 1980 and 2009, and they found that anxiety disorders are common across the globe with an estimated current prevalence of approximately as much as 28% on the global population. Benzodiazepines are effective in reducing anxiety related symptoms in 70 to 80% of people. Symptoms vary considerably across time and go into remission with a placebo in 25 to 30% of clients. Benzodiazepines also serve as sedatives, muscle relaxants, intravenous anesthetics, and anticonvulsants. In 2008, approximately 5.2% of U.S. adults aged 18 to 80 years used benzodiazepines. The percentage who use benzodiazepines increased with age from 2.6%, which is ages 18 to 35 years, to 5.4%, ages 36 to 50 years, and up to 7.4%, ages 51 through 64 years, and then increase to 8.7 those that are 65 to 80 years of age. Benzodiazepine use was nearly twice as prevalent in women as men. In all age groups, roughly 1/4 of individuals receiving benzodiazepines involved long-acting benzodiazepine use. In the cultural and religious aspect, everyone may have a different thoughts and opinions, beliefs about taking medication. Americans have gone through continued struggles such as 9/11, terrorist attacks, wars, pandemics, corruption, mistrust of government, violence, and so forth. We live in a culture that dismantling traditional values can lead to anxiety. Many are desperate for a cure, so many lean on medication. But some believe that therapy is the key. Mental health professionals need to assess the nature of the client's underlying fears, capacity to tolerate treatment that explores those fears, worry that anxiety is destroying the self and the client's relationship with important others. And I really tend to agree with this assumption. Counseling is key and effective to help with anxiety disorders. What better way to include spirituality as well? If we treat the patients as a whole, this includes physical and spiritual, benzodiazepines and therapy combined will have a positive outcome to reduce anxiety.